about not touching your face and washing and social spacing and now I'd add mask, I feel very comfortable that we're ready. So, there's new tests that you're seeing on television. Nothing's proven to be effective yet. We're working really hard on vaccinations. That is a working, proven vaccination is the thing that will make the world return a little bit to what we're used to. But until then, it's going to look different. When you're in public, we probably should start wearing our mask. It's hard. I can't breathe most of the time, but I put it on and look stupid and go on about my business. In public, social distancing, spacing is going to continue. We all need to support that, and we all need to continue with that. Are there any questions you can ask later after, I think Kevin Roberts would answer probably a lot, but go ahead, Kathy.
I just had one about the masks in public. Because there have been such mixed information. So how do you feel, do you feel that that's something that we all should be wearing when we're out in public?
I think now a little bit. I always like to read the tea leaves. I like to talk and see what other people are saying, what science and information is out there. Tells me today that, the social spacing, whatever was here in March, is definitely diminished. The social spacing has done that, but it's out there. We had a positive case in the county today. I think probably everyone's aware of that now. We still had any positive testing in the clinic, but it's out there. And if I'm sitting here and I'm infected and I'm asymptomatic, I have no symptoms, and I have no idea that I have it, this keeps my breath in. I'm going to be in this room for 10 or 15 minutes. If we're socially spaced, you're likely fine, but that added degree of catching some of the virus here clearly helps. So when you're going to H-E-B, when you're going to Walmart, when you're going to local stores, this protects both of us. It captures some of the virus that I'm breathing and some of the virus that you're breathing. And so it's an added layer of defense, just like a soldier wants his helmet, wants his everything that you can get, you want to get. So I would recommend to all of you, when you're out in public, wear the mask. If you're out on your property on the middle of the lake fishing by yourself or with one of your family members, yeah, you can take the mask off. You've already shared you've already got what each other has. But in any other social setting, this should be the new norm. Are people not going to do it? Sure, they're not going to do it. Does that mean you don't have to? You should. And I think you're going to hear that probably reiterated by anybody in the healthcare community.
Okay, what about I know this is just a picky question, but I'm just trying to wrap my head around everything that you're saying and know when you're supposed to, when it's okay not to.
Right.
But you know how there's a lot of people out walking, by yourself, you're walking, you're out, but you're not really in interaction. Should you just have it with you because of the whole breathing thing?
I don't leave my house without this. Okay. And let's say we're on a jogging trail and you're 15 feet ahead of me and the wind's blowing this way and you cough. That's going to come over me. How much of that virus will actually get into my upper airways and cause infection? We don't know. But if you can have the mask, it's just an added safety for you. And again, reminding, it may not do anything to me if I get the sickness. I may have a cold, but the person I wind up giving it to may not. So we still continue to do these things to protect the most vulnerable members of our communities.
Thank you.
Anybody else? And I've reached out to most of you. I think we update most of y'all. Y'all can all reach out. So I'm first going to introduce Ashley Underwood, again, administrator of the hospital. And Ashley has done a fantastic job, and we owe her very much a debt of gratitude for the work that she's done to get our hospital ready.
Thank you, Dr. Kane. I won't take much of your time. I just want to echo his sentiments and thank you because of what you all have done. You have given us the time that we needed to get our supplies in-house and to get our processes in place so that we could not only keep the patients that come to us safe, but keep our staff safe as well. I do want to put on my parent hat just for a minute. I'm going to tell you, just like I told my kids, we feel like we have flattened the curve. We did what we needed to do, right? But let's not forget and let's not repeat history. When they had the Spanish flu pandemic, the second wave was 10 times the amount of the first wave. And it's because everybody was sick of staying at home, right? Everybody was ready to get out. My kids are like rabid dogs that I'm trying to rein in because they are so tired and they just want to go back to normal. but we're not ready to go back to normal. This is the new normal. This is going to be the new, let's make a statement, a fashion statement with these masks, ladies, right? This is what we need to do, continue to do, safe social spacing, and make sure that we are still keeping all of our precautions intact, because just because we flatten the curve does not mean it's over by any means. So I just ask you to all continue to be cautious, continue to educate everyone that you see and everyone that you come in contact with. But again, thank you so much.
Thanks, Ashley. And Ms. Walsh and the EDC and the Chamber, if I didn't mention them in thank yous earlier, same thing there. Thanks, Ashley. So now I'd like to introduce Kevin Roberts. Kevin's been with us a year? About a year and a half, stepped in, has done a wonderful job before all of this. As you all know, we sold the clinic last year to Advent Health. And, you know, two things I've learned in this whole experience. If there was any doubt as to why I moved here, you know, I was looking to a place to raise my kids in small town America. That decision was the right one. And selling the clinic to Advent, this is where we belong. If they've shown me anything through this, there's no question. We interviewed every major player out there. They are who we belong with, and I'm glad to be a part of them and proud to help work with them and support them. Kevin's the CEO, and he's a business guy, and is in charge of a large hospital system here in Central Texas, one of the largest health systems in the country, Advent nationally. And something you may not know about him, he started out in nursing. And he is a nurse, and I love that about him. He's a nurse. I started out in nursing. I'm a doctor now, but they have done a wonderful job at putting their heads around this, and their teams, as well as all of y'all's teams, have done a wonderful job. But not only does he understand the business side, but he also understands the science part. And when this is over, we're going to give him some kind of honorary MD. I don't know if it'll be in epidemiology or infectious disease, maybe family practice. I would vote for that. But they've done better than I ever could have imagined. And without further ado, Kevin.
Thank you, Dr. Kane. I will take off my mask while I give a speech, and I will lay it purposefully right there. Up. Okay. He's kind of my my COVID police. I love Dr. Kane, and he's been an excellent supporter. I know he's been a great educator and communicator about this disease here in Lampasas County, and so I really appreciate him. So I am the president and CEO of Advent Health Central Texas and Rawlinsbrook. I consider us one unit network. I know you folks are more accustomed to Rawlinsbrook Community Hospital here, and it's been here for decades. But I look at us as a network, and so the assets and the resources that we have in Killeen, Advent Health Central Texas, formerly known as Metroplex, are becoming more and more accessible here, and I'm going to talk about that in a minute. But first, let's talk about this crisis that we've all been through. What a crazy nightmare, hasn't it been? Just the wildest time in my life. I've been a nurse for 40 years this year and never encountered anything like this. I've been an administrator for about 30 of those 40 years. And so I've gotten it has been a nice balance of the science and the clinical medicine and all of the stuff that we think through, in addition to making sure that the hospital has what it needs to serve its communities. But before I go into that, I want to thank you, because we see on television how the hospitals and the healthcare providers are the heroes of the community. Well, I'm going to put a mirror up, and I'm going to say you are our heroes. And you are our heroes because you listened. You did wear the masks. You did the social distancing. You did wash your hands and not touch your face. I'm not that good at that, but I'm still working on it. And you have bent the curve, and the curve is truly bent here. I get what we call predictive modeling reports. And predictive modeling is where a bunch of statisticians sit down with a bunch of epidemiologists and a bunch of demographers, and they figure out, they put all these things together. Well, what's the size of the population? What's the age of the population? How much virus is there? What is the behavior of this virus? How long does it incubate? And they all bring their brains together, and they come up with these magic numbers called predictive modeling. And ours, we've gotten 2 cycles out of predictive modeling in the last 3 weeks. And I just got my last one, let's see, I think about Thursday. And it shows, I mean, it's not even a molehill what the predictive modeling shows in Lampasas and Killeen, because those are the communities that I have to keep in mind at all times. And that is really good news. But as Dr. Kane has mentioned, this is a volatile virus. It's like fire. You give it new fuel, it's going to burn. Right now, it's smoldering at best, but we don't want to give it fuel. So that's why I'm going to echo Dr. Kane's advice. You know, masks are good. Where do I not wear a mask? In my car, in my house, and in my office, as long as nobody's in there. The minute somebody walks in, I reach over, put my mask on. If they don't have a mask when they walk in, I ask them to wear one. Of course, we've all figured this out, so we're very good at it now. But so this is still working, and it is a little peculiar. And Lord, let's hope that we don't have to do it for a long, long time. But the short time that we are doing it is worthwhile. I also wanted to share with you that Advent Health, which is our corporate parent, which is based in Orlando, Florida, and we have almost 50 hospitals in 9 states, really puts its mission where its wallet is. And Advent Health committed to keeping you've seen our taglines on the billboards. It says, feel whole, right? Nice, short, succinct brand promise, we call it. But we made sure, our company made sure that our team members or our employees were made whole, or kept whole during this crisis. And we have assured all of our employees that they were going to preserve their income back in the middle of March through June 6th, which means no layoffs, no furloughs, not even any significant flexing, which hospitals have done, excuse me, all the time. And that was because we wanted our employees to be able to focus on what was important: fighting the virus, adapting to all of these new protocols, redeploying in different areas. If you walk into our hospital, you'll see, I'm sure she has a great smile under her mask, but she's sitting there making sure that, that we take your temperature before you come into the hospital, just like family medicine clinic down the street. And checking temperature, asking you questions, making sure that we're not bringing these bugs into the hospital. So those people didn't exist 6 weeks ago or 7 weeks ago. So we have repurposed people. So we have found ways to use our workforce and keep our team members whole. And I think that is a testimony to a health system that has a big heart, has had a reservoir of fiscal responsibility, and is committed to its employees virtually at all costs. Other things that we did was, I don't know that they had to exercise it here, but we created childcare options for our team members, because remember, the kids are home. What are you going to do if you have to go in and pull a shift? Psychological support, all kinds of things to make sure that our employees felt loved and prepared to do what they were there to do. One of the silver linings of this whole COVID thing is the innovation and creativity and teamwork that has emanated from it. Our staff have been so engaged with each other and have made almost instantaneous things. Any of you drive by, one day, when did you put up your tent out by the ER? First one. No, the second one, the white one. That was about 3 weeks ago. So if you drove by Rollinsbrook in the morning one day, it looked like Rollinsbrook. You drove by at noon, and there was this fully erected tent, and it wasn't just a tent standing there by itself. It had computers, x-ray machines, all kinds of things inside, because we were testing everybody outside in the fresh air, which was the best practice at the time. And they did this in literally no time at all, and it was just a testimony to the amazing team that we have over there, amazing leadership of Ashley and Juana and Dr. Johnson, everybody coming together and making that happen. It was pretty amazing. We have plenty of testing capability. I know that's part of the national conversation. Now, our testing is about sick people, people that are either symptomatic with those symptoms, cough, fever, chills, what are the other big ones? Runny nose, you know, basically basic cold symptoms, or if you were exposed to a known COVID patient. So we have plenty of testing for that. We're not doing random testing, meaning that we just walk around and pass a cup or a swab around to y'all, but it's more about focusing on those that might have the disease so that we can identify that and manage their contacts. At some point in time, as the public health officials get involved, we may get to the point where there's random testing and everybody can, you know, just go home and test themselves once a week. We're not there yet. But as a healthcare system, for what we are here to do, we are fine. And we've had great support from Baylor Scott & White, who is our partner at Admin Health Central Texas, and our own in-house laboratories. So you've been in pretty good shape there. What are we doing now? So we are getting ready to reopen our hospitals, just like all the other businesses that are preparing to reopen. And so Governor Abbott's order gave us some latitude, and so we're getting ready to do that. In Killeen, we've already opened up our diagnostic imaging, x-rays, ultrasound, echoes, mammography starts up tomorrow, and we're doing that here as well. And so those services are also coming back live here in Lampasas. But then there's the next stage of elective procedures like cataract surgery, colonoscopies, orthopedic surgery, podiatric surgery. Those are all available here in Lampasas now, but they've been hibernating for about 6 weeks. So Ashley and her team and the doctors are preparing to ramp those back up. So what are we going to do to keep you safe? Well, first, we're going to test every patient that comes in for an elective procedure beforehand. So if you're going to get your colonoscopy or going to get your cataract done, think ahead, because we're going to be saying, okay, we want to do a COVID test on you to make sure that you're not going to bring that. You're not one of those asymptomatic reservoirs of the COVID test. And so we're going to test that, and it's going to give you some peace of mind too. Say, hey, I didn't think I had it, but now I know I don't have it. But we're going to go one step further. We're going to test all of our employees. So when you walk in to that operating room for one of these procedures, you will be assured that the doctor's been tested, the anesthesiologist's been tested, the nurses have been tested. So we want you to have confidence that we are doing everything we can to keep you safe. We can't say that we are COVID-free. That is an exaggeration. This is way too sneaky of a virus to declare COVID-free status. But we are COVID-ready, meaning that we are prepared to keep you safe and keep our employees safe all at the same time. Hopefully that gives you some comfort and confidence that your hospital is ready to roll. We have plenty of PPE, personal protective equipment. That's these masks, N95 masks when they're appropriate, gowns, gloves, hoods, the whole deal. I wouldn't say we have enough to spread around, but we are comfortable and confident in our ability to serve our patients, both here and in Killeen. Very important. We have the employee testing resources. We also have what we call rapid testing for our patients, which means that Ashley, if one of you come in or one of your family members comes into our emergency room, thinks they might have COVID, she can have those samples run all the way to Killeen, and in a couple hours we'll know whether you've got the virus or not. Pretty cool. It's much better than waiting a few days to find out whether you've got it or not. We also have our cardiology coming back. Dr. Patel, many of you have met Dr. Patel, and he will be resuming his office hours at Advent Health Family Medicine Clinic here shortly, and doing the echocardiograms. Now, of course, we'll be, when we have someone in for a procedure like that, we may be having a COVID test in advance, because there's lots of breathing and sweating and all that kind of stuff going on a treadmill. So we also started something just Friday, Thursday, Hospitalist? Thursday, we started something that you should be very interested in, and that is our Hospitalist Program. Now, a hospitalist is a physician who has dedicated his or her career to taking care of hospitalized inpatients. That's all they do. They're specially trained. They can, most of them are internists, are board-certified internal medicine doctors, and they design their career and their schedules around being a hospitalist. Well, starting last Thursday, we now have 24-hour, 7-day-a-week in-house hospitalists, meaning they live there. They literally do live there for 5 to 7 days at a time, and then we bring in another fresh hospitalist. This is through a contract that Ashley and our team put together back in December, and we finally pulled it off. And what that tells you is that Dr. Kane and his colleagues at the Advent Health Family Medicine Clinic can now dedicate their time and attention to community medicine, which they love the most. And so they don't have to see their patients. They can stop by and check in on you, but the primary care doctor will be your hospitalist. And they're all, like I say, board-certified internists. They'll be working closely with the emergency room doctors, and that will be, that's a wonderful thing because it keeps you in Lampasas. I mean, if you need to come to Colleen for services at Advent Health Central Texas, we're happy as clams to do that. But we would rather you stay here. We know that's where you want to be. This is your hospital. So having the hospitalist here is going to facilitate your ability to stay in Lampasas and get the high quality care you're accustomed to. And it's allowing our family doctors to focus on their clinic medicine. And so it's going to work out great. So that is the highlights of how we're going about this. And we're going to be incremental at our reopening, but in no time at all, we should have the hospital fully operational as it was before COVID showed up. So that is the summary. We also are going into, you hear about the antibody testing. Antibodies are those things that your body forms after you've had the virus. It's kind of this little tag left in your bloodstream that says, hey, I was here, but I'm dead and I'm gone now. And your body beat me, actually. The antibody is your immune response, the victory. Maybe it's a victory lap. How's that? Of the body saying we won the battle. And so we're going to be having antibody testing available in the next couple of weeks out of Advent Health Central Texas. And we do all of that correspondence. Whatever is available there is virtually available here, just in a car ride. So that's a good thing too. So any questions that you have about what's going on in your hospital and with our testing protocols and so forth?
I had one question.
Yes, ma'am.
One of the things, you answered one, so that was great, about the speed on the testing. When, like, for example, we had the new patient or the new person come up that was COVID positive.
Yes.
Because I know because there's such strict HIPAA regulations and stuff like that, how do y'all get in contact with people that they had direct contact with? Do they like give lists, or how does that work?
I think most of that goes through the local health department. Every positive test is reported directly to them, and HIPAA does not apply to them because they're the ones protecting the public. I mean, they are duty bound by the HIPAA rules, but they have a right to know because they're managing the public health. So, Dr. Kane.
I'm sorry, Dr. Kane, because we are live streaming it and recording the meeting, can I get you on the microphone? I'm sorry.
So the way the testings work in real time, at least with us, and I think most places. So we did 20 or 30 tests today here in Lampasas. I don't know how many we did in Killeen. I didn't get those late afternoon numbers, but yeah. So we're doing lots of testing, and the way this works, if that test it gets done here, it gets sent out. When that test hits positive at the lab, and I'm pretty sure this is the same way Quest, most people are familiar with Quest, they make a call to the state health department. That's to make sure that no matter where it winds up in some little town somewhere, that it's reported. Once that report gets done, we're called. And then our job here locally with Kim Gabar at the clinic is we simultaneously try to get in touch with the patient. We certainly want to get in touch with the patient first. And of course, if it's one of our doctors, we want the doctor making the call to the patient, because that first wave of questions is not going to be who I've been in contact with, is what do I need to do? So the test lab, positive, phone call to the state, phone call to us, and then we simultaneously try to get in touch with the patient, the local health department, which was Region 7 out of Killeen, and then to our COVID team, the people that are actually managing the test that we have. They've got some systems in Killeen put in place where they're finding homeless people to result, and they've got people that are doing that. That will swing back around, and the local county health, Dr. Hay, kind of takes it from there. And, you know, the mapping and getting screens and answering the questions, that's a whole nother big ball of wax. But basically at that point, by the time it's gone through all that, I mean, you basically have got 3 people that have contacted, it's confirmed. And then she will swing back, or we'll always make sure we're all communicating that the emergency services know, the police, the fire, in case they have to go out to that home before they know. And that kind of loops the circle. And we're all communicating, you know, most of this real time. And, you know, we try to get you all that information about testing and positivity and all that a little bit ahead of even when that's filtered down. But usually sometimes we'll know, and until that patient's been contacted, a lot of that's not going to be released. And then the mapping of who they've come into contact with, as that moves forward, is going to be a huge job. And, you know, they're putting people and systems in place to do some of that you know, finding out who you've been in contact with and calling them. Does that help answer how that works?
Yes, sir. That helps a lot. Thank you.
I'm going to tag on to that a little bit, how Advent Health works with those patients, because one of our principles is we never discharge a patient, meaning when they leave, we still want them to depend on us for their care. So once we have a COVID positive patient that is identified at one of our hospitals, of course, the contact tracing is a public health issue, so the health department will do that. But we start a follow-up communication with that patient. We call them on the phone. How are you doing? Are your symptoms getting better? Are they getting worse? Did you get the medicine that you were asked to check? And so we keep checking on them, actually through our network in Florida, to make sure that they have everything they need. And you don't want to leave someone with this disease just strictly on their own. I mean, if it's a low acuity case, they're going to be fine, but it could get worse. And so our health system commits to those patients to check in on them to say, how you doing? Do you need anything? And if so, here's how we can connect the dots for you.
Okay, so you'd like, kind of like when they have to self-quarantine or whatever, y'all help them with that kind of process and make sure that they're doing what they're supposed to be doing and all that?
Yes,
Okay.
yes, we do.
Thank you.
You're welcome. Is that it? All right.
We appreciate y'all being here.
Well, thank you for the privilege of sharing with y'all. And again, keep up the great work. It's working. We'll be back to normal, whatever the heck that is, one of these days. God bless y'all.
Thank you so much.
Thank you.
Next item on the workshop agenda is discussion regarding any item on the regular agenda. Does anyone wish to address anything on the regular agenda? No? Do you have a motion to adjourn workshop?
So moved.
Second.
I have a motion and a second. All in favor, please say aye.
Aye.
It is 6 o'clock. We can roll into the regular session unless anyone needs to take a 5-minute break. We're all good? Do you need a break?
Doesn't matter, whatever the majority wants to do.
Let's take a 5-minute break and then we'll reconvene. We're going to go ahead and call to order the regular session of the governing body of the City of Lampasas. Before we proceed any further in the meeting, a couple of times I'm going to try to remember to share the phone number to call into the council chambers is going to be 512-556-0332. We've also been notified that there was another delay between the live stream and when the meeting began, but the full recording is going to be available. The audio recording has started from the beginning. If we would all at this time please rise, and Chief Bailey, if you'll lead us in invocation, please.
Please join me in prayer. Heavenly Father, we come to you tonight to thank you for the many blessings that you give us. Father, we thank you for precautions for the coronavirus, for the healthcare workers, for first responders, and for our leaders. Thank you for providing us with all of these means to protect ourselves. Father, we ask that you watch over us and continue to protect us, and that you guide us and direct us daily. Father, please see that everyone here makes it home safely tonight. In Jesus' name we pray. Amen.
We don't have any proclamations or presentations this evening, so item 1.1 is going to be public hearing and citizens' comments. Any citizen who desires to address the city council on a matter not included on the agenda may do so at this time. The city council may not deliberate on items presented under this agenda item. Again, the phone number is 512-556-0332. I believe Mr. Clark wanted to address the council during public.
I do. Thank you, Mayor. I'd like to address my remarks to the mayor, the city council, the city manager, city staff, and the citizens of this community. At last Monday night's council meeting, I got angry during an agenda item. I said a lot of things I regret, and I also carried it on until after the meeting, and I apologize for that. Some of the comments that I made were accusatory, rude, and inappropriate, and I exhibited poor judgment and that was unbecoming of the position of a city council member. To each and every one of you, I'd like to say that I'm sorry for my actions. I would offer my sincerest apology to each and every one of you. Thank you for allowing me.
Thank you, Mr. Clark. Do we have any other citizens' comments? Item 1.2, citizens' comments. Any citizen who desires to address the city council on a matter that is included on the agenda may do so at this time. Again, 512-556-0332. We're going to move on to item 1.3, public hearing to receive citizen comments regarding the LEDC Business Emergency Grant Program. Continue to move on. 2.0 minutes. 2.1, discussion and possible action concerning approval of minutes of the regular meeting on April 13th, 2020.
I didn't notice any mistakes. I would move to approve those minutes.
Second.
I have a motion and a second. All in favor, please say aye.
Aye.
That is unanimous. 2.2, discussion and possible action concerning approval of minutes of the special session on April 20th, 2020.
Move to approve.
Second.
I do have a motion and a second. All in favor, please say aye.
Aye.
That is unanimous as well. 3.0, consent agenda. Item 3.1, discussion and possible action regarding the monthly investment report for March 2020. Do I have a motion to approve the consent agenda?
Motion to approve.
Second.
A motion and a second. All in favor, please say aye.
Aye.
It's unanimous. 4.0, board and department reports. Looks like we've got the golf course monthly report on there.
Van is not here to provide his monthly report. He will follow up at a
Okay.
later time.
Thank you. Item 5.0, routine matters. 5.1, city manager's operational report.
Mayor and Council, just a couple of brief comments. We continue to work with our consultants on the comprehensive plan. We are entering kind of the last phase or the last quarter of the planning process with them. I think what we would envision in terms of path forward would be we have to reintroduce our CPAC committee to the work we've done thus far, and I think we'll probably spend 1 or 2 meetings perhaps even without the consultants. We've discussed that with folks at HAF just to say, this is what we did Chapter 1, Chapter 2, so on. I think the other thing that will require probably 1 or 2 additional meetings will be the implementation phase, which is the phase that council felt very strongly about in terms of, what's our roadmap forward. And as we've started to look at that, we'll continue to work on that as staff and consultant. Try to start getting our CPAC prepared for a meeting perhaps as soon as late May, if we can get people spread out and carry this process forward. Vision Lampasas, the city was contacted by Libby Blunser last week about a kind of a different type of project than you're used to seeing them do. They'd like to spend some time and effort and resources towards the entrance sign on North 281 by the airport. Basically to dress that up, do some plantings around it, xeriscape it and then widen the foundation of it. And then eventually do a complementary marker on South 183 coming into town from the south. I told her, even though I hadn't had the chance to talk to council about this, but I said I doubt there'd be any objection to moving forward. And it's certainly be a benefit to them, and we want to support them and all the work that they have done and continue to do. Brody Estates, just to let you know that Ricky Roy is working with a developer at Brody Estates about something that we've kicked around a little bit, but in terms of going underground electric to those residents. And as we kind of, the developer is open to that, and I think the city would like to see if we can't come up with something that would be a cost neutral on that sort of installation. I think because of the scale of this subdivision and the relative density, it might be a good example for future subdivisions that come into town in terms of how we design and implement and what sort of policies we have in place for underground installation. Business assistance, and I think Mandy can chime in on this as well, but we did push out both applications again for the utility assistance and the emergency assistance program, the EDC program and the city program. I believe at the time that I pinned this memo, there were about 30 applications for the EDC program, and then on Friday we mailed out about 55 or 60 applications to businesses for the utility assistance. But I think both of those are being received well. Mandy, any update in terms of numbers?
For the EDC, we're currently around 40 applicants. I know of a few others that are putting theirs together now. Total cost, what we're looking at is probably around $75,000 of where we're at now. So as you remember, we had a certain amount allocated to fund this. So we're trying to encourage people to get their applications in soon, but we've had a pretty positive response, so I'm pleased.
And finally, although it's not in your memo, an unintended consequence of our COVID, just to let you know, and you may have received phone calls on this already, but our trash haulers are getting packed out early. So folks are at home, they're doing stuff around the house, they've got a lot of trash, and on the flip side, a lot of dumpsters are empty, around these businesses. So if you get a call about trash not being picked up in a certain neighborhood, they have done a pretty good job about making sure they get it first thing the next day. They've even come in on Wednesday, which they're normally not in town for. But please bear with us, and if somebody has been in your ear a little bit, have them call City Hall, and we'll see if we can't give it the attention it needs.
Thank you, Finley. Item 5.2, Mayor's comments. I don't believe I have anything to share for y'all this evening. 6.0, unfinished business. We don't have any of that either. 7.0, new business. 7.1, discussion and possible action regarding the adoption of the LEDC Business Emergency Grant Program by resolution of the City of Lampasas City Council.
Good evening. This is the EDC Emergency Grant Program that was approved on April 15th by the EDC Board and then approved in last Monday, April 20th, special session with City Council. So we're asking for this second reading to approve the program by resolution by City Council.
Recommend approval.
Second.
I have a motion and a second from Mr. White. All in favor, please say aye.
Aye.
It's unanimous. Thank you. 7.2, discussion and possible action regarding the City of Lampasas emergency declaration, stay home, stay safe.
Mayor and Council, this was placed on the agenda as a placeholder. We, at the time of posting, we did not know what action the governor might take or what latitude he might give to smaller counties. I think he's come up with a somewhat unambiguous order this afternoon that we will attempt to follow. The question, maybe the most obvious one, is whether we automatically fall into the 50% occupancy for restaurants, movie theaters, et cetera. That has to be filed through the county judge to the state. So, you know, at this time, as of Friday, those businesses that the governor opened up to a certain extent will have a 25% occupancy. I think, just as a reminder, all of the governor's previous orders have been followed up within a week to a week and a half by additional guidance and clarification, and there may be an opportunity for that. He did call for a phase 2 no later than or on or about May 18th to do an assessment in terms of how effective phase 1 was. It's certainly my hope that the governor would act more quickly on some cases and try to move things along. However, as he said, it would be done based on the advice of his medical team as well as the advice of the business community. In terms of particular action that council may consider, frankly, I don't know that you have any latitude whatsoever based on the governor's order this afternoon. There certainly is indicated in his press conference. So in terms of any additional orders, either more restrictive, less restrictive, frankly, I don't think council can take that up at this time. I would defer to Chief Smith if he had any additional comments on this.
Does council have any additional comments or questions for Chief Smith? Does Chief Smith have any additional comments for council?
Not at this time. We're waiting for the governor to, as the city manager said, he usually comes out pretty quickly with some different rulings on that to clarify some things. I was on a conference call this afternoon. There were many questions from people calling in, and they said that we'll get back to you on Wednesday. Hopefully we'll have that information soon. And like city manager said, as far as us going up to 50% capacity, that all rests with the county. So we'll go from there.
Could I ask about the percentage? It was my understanding when I listened to the governor that the first phase was 25% capacity, and now you guys are saying 50?
He gave a stipulation that counties with less than 5 cases could possibly go to the 50% capacity.
Oh, I didn't see that. Okay, thanks.
Yes. And that was based off of, 204 out of 254 counties have the COVID right now. So you still have 50 counties that have nothing, they have no idea what we've been going through or doing anything, so.
All right.
Thank you, Chief. Do you have a motion at this time to adjourn into executive session?
So moved.
Second.
A motion is second. All in favor, please say aye.
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 The City Council of the City of Lampasas, Texas will meet in closed executive session pursuant to Texas Government Code, Chapter 551 as follows. Item 8.1, Section 551.087, Economic Development. 1, to receive and evaluate financial information received from a business prospect, to discuss same and/or to deliberate regarding commercial or financial information that the city has received from a business prospect that the city seeks to have locate, stay, or expand in or near the city, with which the city is conducting economic development negotiations, and/or 2, to deliberate an offer of any financial or other incentives to any business prospect described above. Also, item 8.2, section 551.071, 1, consultation with attorney by telephone and/or in person concerning matters upon which the attorney has a duty and/or responsibility to report to the governmental body.
Where are we headed?
Sammy, you cut your hair. Good. All right, we're going to reconvene out of executive session back into regular session. Item 9.0, action on executive session. 9.1, discussion and possible action concerning items posted and discussed by council in executive session. I believe we have any action to take. Do I have a motion to adjourn this evening's meeting?
So moved.
A motion and a second. All in favor, please say aye.
Aye.
That is unanimous. Thank you.